investigation of the fetal conditions, they are the same as methods of investigation of pregnant women. Ёлки-палки. Guys, excuse me, I take another presentation. I need to look for English presentation, guys. Так, так, pathology of neonatal period. Так, pathology of neonatal period. Come. Guys, very quickly, we have 30 minutes for this topic. You don't know exactly pathology of neonatal periods. It is include our topic. Then we'll speak about the methods of investigation of так, need he came to us. Так, need he. When we'll speak about the methods of investigation of newborn, of in the prenatal period and investigation of newborn. First of all, what does it mean, pathology of neonatal period? It is, first of all, transitional states of newborn. Most of you, if somebody asks you on exam about the transitional states of newborn, you don't know what to answer. First of all, it is the period when the newborn in adaptation to outside life, if in simple words, the period of formation of the health of the newborn and appear some conditions which reproduce the process of adaptation to new conditions of the life, usually. And what is the main characteristic of these periods? They pass without any efforts on the side of the doctors. They disappear without treatment and without any therapeutic and surgical intervention. First of all, it is the signs of hyperventilation of the fetus. It is frequent breath of the fetus. It high parameters of minute pulmonary ventilation during the first 3 days in newborn. If we compare with older fetus, it is abnormal sign, but usually specific for this hyperventilation, specific for the first days of life of the fetus, first days of life of the fetus. And usually what happened? Open lungs, and that's why dramatically during when the fetus was inside the uterine cavity, lungs was closed. And when the fetus make the first breath movement, lungs open and dramatically increase the pulmonary blood flow. And that's why appear the high resistant and actively maintain in the pulmonary capillaries. Immediately after birth, the pulmonary vascular resistance starts to fall. The fall is driven by the release of vasoactive substances, including prostaglandin, nitric oxide, and presence of oxygenated blood in the pulmonary capillaries themselves. And that's why we have hyperventilation for 3 months. And they usually without any complications disappear. Also open the arterial duct, you know, Batalov, yes, and this shunt can be pursued both from the left to right or from right to left and in both directions. Existence of transient circulation and characteristic discharge of blood from left to right explain the appearance of cyanosis. Yes, it is disorders. This duct which present in early birth, then this duct open, but due to these changes of the flow of blood, direction of the flow of blood, appear cyanosis. It is also transient state. Auscultatory, it is we doctors reveal, neonatologists reveal the transient heart murmurs usually. Also, after some days of life, this murmur disappear. Another transient state of newborn, it is the simple erythema. Usually occur immediately after a newborn skin toilet. Dynamics up to second day of life, erythema increases and then disappear spontaneously. If it is erythema toxicum, it is common rash which usually appears on the second or third day and take forms of white pinpoints hard on an oval rhematose base. If the spots are biopsied, massive numbers of eosinophils revealed. The rash rarely lasts for more than a few days and is harmless. Usually also birth tumor. I told you some words about the birth tumor. It is, you see here, it is edema on the fetus head if the fetus head was in one plane of the soft tissues of the fetus head. Prolonged time, the fetus head was in the same place of the pelvic. You can meet another name of the birth tumor, generic tumor, usually localized in the parietal occipital region, and the head is slightly extended posteriorly due to this. The swelling of the tissues in the area of birth tumor is soft, superficially located. With palpation, there are traces of pressure. The birth tumor is not limited by the cranial sutures. If we compare with intracranial hematomas or cephalogемatomas maybe, usually it is only soft tissues and disappear in 3-5 days of life of the fetus, and no need in any hour treatment. Physiological jaundice also appear on the third day of life. You see here after 36 hours and manifest on the third, fourth day. It is appear and then disappear completely on the 7th to 10th day. Usually the reason of this condition, it is insufficient of caloric intake. You know that breastfeeding, really breast appear on the third day after labor in woman. That's why decrease of caloric at first 3 days, it is colostrum, which characterized with decrease of the number of fat and number of volume, and that's why these 3 days feta in a condition of jaundice. Yes, due to dehydration are associated with inadequate breast milk intake and can lead sometimes to severe hyperbilirubinemia, which colorize the skin in a yellow color. In presence of jaundice, the medical examination should include an assessment of baby's condition after birth, the adequacy of the volume of milk consumed, and the number of urination and feces, and the determination of the severity of jaundice, because we need to make the difference with incompatibility, rhesus incompatibility for some time. Moderately jaundice skin, it is defined as monosymptomatic. Usually we have one symptom only, jaundice. We have neither enlargement of the liver, never enlargement of the spleen, no discoloration of the feces and urine, which is specific for rhesus conflict. And usually there is no abnormalities of neurological status, which is also specific for rhesus conflict. And we only wait. There is no any specific treatment. This is the view of the newborn with physiological jaundice you see here. Also, transient state in newborn, it is the loss of primary body weight. About 5 to 10% of infants who are breastfed lose more than 10% of their body weight at birth by the third day of their life. And it is need in indicating of dynamic monitoring of the condition. The main cause again of loss of the weight, it is the lack of the milk and water in the first days of life on the newborn. Prevention to this condition, it is strict adherence to the rules of the care of newborn, early application to the breast, adherence to optimal modes of the temperature and humidity. In addition to the absence of the weight loss, more than 10%, 2 to 5 urinations should be present, yes, and 3 to 4 acts of defecation. It is the normal of for the child. In most children, body weight is restored on the 5th, 7th day. Hyperemia also present, occur in the same terms as transient weight loss of the primary body, which is the main cause of the transient hyperemia, is considered to be insufficient water intake. In addition to raising the body temperature to 39 and above, the baby has anxiety, dryness of the skin, and mucous membrane. Our management, immediate elimination of causes of overheating, physical cooling, release from diapers, adjustment of drinking water regime allow to not normalize this condition, but also it's not very severe. Hypothermia also, it is results from improper organization of newborn care. For the prevention of transient hypothermia, the requirements for the care of the newborn in the maternal room and in the human ward should be strictly fulfilled. It depends, first of all, of the mother of the child. Very specific, it is sexual crisis. First, there is a pinching, a gradual symmetric enlargement of the breast. Here you see the picture of the mastitis, but usually we have the enlargement of the breast of the newborn from the third to fourth. And guys, Suresh, maybe can you tell me, maybe I don't hear you, Suresh. No, we have, can you tell me something, Suresh? You raise the hand, I see. Suresh, where is you?
Teacher, we cannot see the screen.
Suresh,
We cannot see the screen.
Suresh, I see
Yes,
you
yes,
raise the
teacher.
hand, but I don't hear you.
Cannot see the PDF, teacher.
Um, and continues to changing without hyperemia and hypothermia alone or as a reaction to palpation of the gland. Sometimes secretion of milk present. It is advisable to use warm compressed sterile and bandage. The reason of this condition, it is when the feet was inside the uterine cavity. Guys, somebody, Yamin sent, так, Yamin. Так. Yamin tell me that he cannot see the presentation. Only he or all group, guys? Can you tell me, because it is other computer, as for me, need to be visible for all group. Guys, you see, maybe... Так. Так, Yamin, we are talking, but you can't hear us. I can't hear you. I don't know. It is other computer. I am on department. I was with you at home, and here I am in department, my dears. And I have only this computer. Guys, I don't know why, what happened. Guys, now I stop my demonstration, yes, and we will meet with you at 10 and 45. I want to see, ну, ваша демонстрация экрана приостановлена. I don't know why. Новая демонстрация.